another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Dr. Roy Nambudripad, and he'll be speaking on an allergy elimination technique called NAET, specifically for preconception, pregnancy, and infant health. Roy completed his undergraduate and medical school education at the University of California at Irvine. He then completed a 4-year residency in surgical and clinical pathology at UC Irvine Medical Center, which is a field focused on medical and surgical diagnosis. Subsequently, Roy spent a year training and getting certified in medical acupuncture through the UCLA Stanford program under the tutelage of Joseph Helms, MD. He is a member of the American Academy of Medical Acupuncture, as well as the Director of Research for the NAR Foundation, an organization focused on researching forms of non-conventional allergy treatment. In addition, he spent many years training in NAET with his world-renowned mother, Dr. Devi. He specializes in NAET and medical acupuncture. His publications have appeared in peer-reviewed medical journals such as Circulation, International Journal of Surgical Pathology, Archives of Pathology and Laboratory Medicine, and Global Advances in Health and Medicine. In addition, he has presented his research in medicine at professional society meetings and given international talks on NAET. Roy enjoys spending time with his family and is also studying for law school, which he hopes to complete in 2017. For more information, visit naet.com. Welcome, Roy.
Hi, thank you.
I'm excited to have you on the show today to share, your wisdom and your expertise regarding this really fascinating and awesome technique called NAET.
Yeah, it's very exciting stuff, and I'm glad to be here.
Thank you. And I figured, who better to get to speak on this than, the son of the creator, Dr. Devi Nambudripad's your mother, and I think that's so cool. Like, you grew up with this technique, and it's been a part of your life, your entire life.
Yeah, and the interesting thing from my perspective is I have a kind of a good sense of, both sides of the coin, so to speak, the Western and the Eastern. As you said, I grew up with my mom and getting treatments as I was a child, basically for all my allergies and illnesses. And I know how wonderful it has worked for me, as well as for patients, for my mom. When I was growing up, I would hear all these stories and see the patients and see how, they would cry and give hugs to my mom and a lot of her practitioners and things. So I saw that side. But at the same time, I went to medical school too, just because I was curious and I wanted to learn more about this whole field. And I went that route and saw the kind of the dark side, so to speak. Of course, there's a lot of benefits and downsides to medicine as well. But, it gave me a good perspective of how things are done in that realm, in the hospital anyway. And so, I have a kind of a unique advantage in terms of how to approach patients, I think, with NAET.
Yeah. So can you just start off by telling our audience, what is NAET? Sure.
NAET stands for Nambudripad's Allergy Elimination Technique. So that's my last name, Nambudripad, of course. The allergy elimination technique part just refers to essentially how this started. We use this technique, which is an acupressure, acupuncture, and chiropractic technique that my mom designed actually herself. Over years of experience with her illnesses and issues, in order to help reduce reactions to foods, essentially is how it started. The word allergy is a very kind of vague term. In medicine, there's specific, uses for it, but the concept that NAET holds to is generally just like any type of reaction you have to any food or substance, chemical, metal, even to people, animals, etc. Any type of adverse reaction that you as a patient have, this technique would help reduce that reaction and in some cases eliminate it, actually, just like the word says. So it's very non-invasive, as I said, based on acupressure essentially and chiropractic. We do certain adjustments to the spine and stimulate certain points in the body. In some cases, we use acupuncture with needles. And in some cases, we actually have the patients holding real samples, real foods, having them exposed to the item while we treat them with these points. In most cases, though, we just use vials, homeopathic vials, to be very safe. And so for the most part, it's a very safe technique, and it's very effective. And the only thing is it does take some time as opposed to Western medicine where, you just take one pill and, it kind of acts as a Band-Aid and gets rid of the symptoms right away. But NAET takes more time. However, it gets more to the root cause of the problem, in my opinion. I think, we still are investigating this and doing a lot of research on this, but there's something that causes the human body to react adversely to, foods and chemicals. And I think this touches upon that reaction, and why that reaction is happening. So that's where I think the beauty of this technique is, and it's, anyone is I think, welcome to try it to see.
Yeah, it's really fascinating. I discovered NAET as a patient when I was fresh out of chiropractic school and was so excited about the results that I saw for myself that I decided to train in 2008 and become a practitioner. So I've been using it in my office ever since, and it really is, it's totally non-invasive, it's safe, and it's really, really effective for all types of allergies.
Mm-hmm.
I love it.
Yeah, I agree.
And yeah, I always thought it was very interesting about how it was discovered. Do you mind just spending a couple minutes talking about how your mother discovered this technique and why she discovered it?
Yeah, absolutely. So my mother was a nurse, actually, an ICU nurse for many years. She had a lot of arthritis and lung issues like asthma, and she had a lot of body aches and pains and things like this. For many years, ever since she was a child, actually, but especially when she was working as a nurse, I think it got a lot worse. And she tried everything, steroids, antibiotics, all kinds of therapies. She even went to a psychiatrist and psychologist. People were saying that it was in her head and all kinds of stuff, kind of typical for what many of our patients go through, actually, when you talk to them these days. She went through that, in the late 70s. Essentially. And then the 80s, early 80s, she, kind of basically came to a head with her symptoms. At the same time, I was born. And by the time I was about 4 or 5 years old, things were just getting really, really bad for her and my dad, obviously having to deal with a baby as well. And I was very sick as well. I had a lot of eczema, and I had a lot of food allergies. I couldn't drink milk, for example, and things like this. So everything just kind of out of desperation, she just started searching for answers. So one day in her chiropractic, she actually went to chiropractic school as a way to see if there was anything they can offer to help her. She's very goal-driven, very motivated person. She just won't give up and just accept what the doctors told her. So she tried all kinds of stuff, including chiropractic school. And when she was in chiropractic school was when I think she ran into an acupuncturist who, somehow she ran into muscle testing. I forget at the moment if it was a chiropractor who showed her or acupuncturist. One of those showed her how to do muscle testing, essentially. And the person...
Probably the chiropractor.
Maybe it could have been a chiropractor, yeah. Showed her muscle testing and showed her that she was allergic to all the foods she was eating except for white rice. And so she basically avoided everything for a long time. When I was very young, that she would just have white rice in her diet, and she felt a lot better. That was kind of the start of things. That's when she realized this concept that it's not just a genetic illness that you're doomed to suffer and you have to take all these meds. You can actually do something about it, including diet changes. So, but of course she didn't want to eat white rice forever. So she kept investigating, and I guess, I honestly don't know what was going through her head at the time, but somehow she figured out these acupressure points and using points in the back and things like this, and put two and two together and figured out that this helps actually. What actually the story goes is, and it's something similar to that, is she was holding some carrots, or she was in contact with some carrots at the time when she was trying to experiment on this, when she was really sick. and she had the carrots on her body, and she woke up after for her sleep, and all of a sudden she felt better. I think that was kind of the impetus for going further and trying this on me as a child, and then my father, her husband, and then and then after that, next thing you know, she started seeing patients in our house, after she finished chiropractic school and her internship. She started working in our house, and we would have patients coming there, and I remember seeing these patients as a child. I used to play with them. And after a couple of years, I think, of practicing from her house, she bought a little small clinic and then started expanding. And then at that point, she was still using real food items, but then eventually she started investigating these vials and homeopathic samples and things like that to make it easier for her, and the different computer systems that would help with all this and all of that. And everything just evolved into this concept of NAET now as we know it. So, and it's still evolving, actually. We're still coming out with new things that we're finding out. And I think in 10 years, 5-10 years, it's going to be actually quite different, and better, more efficient. But we'll see how it goes. Yeah.
It's such a cool story. I mean, from her own multiple food allergies, she was so motivated to find a solution for herself, and then also for you as her child on improving health. And she is a really highly motivated woman, and just making changes and really improving and not accepting the status quo. I think that's a very good point too, that she was really determined to get down to the root cause.
Yeah, she's, without a doubt, I have not met a single woman like her in my life. I love my wife to death, but my mom is really something else. I think my wife would tell you that too. She's really another animal. She's a real role model for me, really, and she's very generous and very kind, and at the same time very, very hardworking. It takes. I just realized over all these years, it takes someone like that really to find something like this, because, I mean, with all those years before her, it's hard to imagine no one had found this already. So yeah, it's really, it gives me chills down my spine when I think about her being my mom and everything. But yeah, it's great. I'm really happy everything turned out well. So.
Yeah. I mean, I really think that she was, put on this earth to discover this technique, and really brought this to the masses. And, 30 years later, more and more people are learning about this. And, I mean, it's really touched. I mean, who knows how many patients have their lives changed from this technique.
Yeah, absolutely. Just the other day, I saw an article on the Internet about someone doing a research study proving that depression is kind of like an allergic reaction, where you have all these inflammatory cytokines and all these things that are coming up triggered by foods and things. And I was just laughing in my mind. My mom was saying this since day one, So I think people are starting to understand this concept. Yeah, it's great.
Yeah, it's true. It's really about, how our energy field is reacting to substances around us and helping to shift that, so we're not being repulsed, foods we're eating, or, exposure to seasonal type allergens, things like that, that one person is going to have no reaction to, and then another person going to have a severe reaction. It could be a physical symptom, but it could also be an emotional symptom, like you just mentioned.
Yeah, I think that's, recently I've had a lot of patients ask me about NAET, and, oh, this sounds like voodoo and hocus pocus. How does this work? And I was telling them, actually the way to think about this, in medicine, all these years, it's been more of a chemical mindset, chemistry of the body, chemistry of the drugs, and chemistry of these and that. Even acupuncture has been basically chemistry. But NAET is touching upon more of an energetic or electromagnetic concept of the body, kind of like the iPhone. The cell phones that are out these days, they're more like they're vastly different from the telegram and the even the landline phones that we were used to back in the day. So I think it's a similar kind of revolution that's going to happen in medicine, where energy medicine is going to be kind of the key word.
I totally agree with that. We are all made up of energy, and we all have our unique fields, and so does every item, whether it's a piece of food or it's an animal or plant or it's something that we're breathing. So it's just having that awareness that that's really what's triggering reactions in people, and it may be a traditional allergy symptom or it may be a non-traditional allergy symptom, but it's still related to that dysfunction almost between those energy fields.
Yes, absolutely. That's the concept of NAT, I think, boiled down to a phrase. So
yeah, I agree, and it's powerful because we're able to impact that energy field, in such a non-invasive, safe manner with this technique.
Yeah, right.
So I was hoping we could spend some time talking about utilizing this technique specifically, for like preconception work and pregnancy. So I was hoping you could talk about how NAT can be used, for example, in a man and a woman who are planning on a pregnancy and preconception. How can it help them?
Yeah, so we don't, unfortunately, have a lot of research in this area specifically. Most of the research we've done officially with NAT has been on traditional allergies and autism. But we do have a lot of anecdotal evidence, a lot of stories, case studies, et cetera. I've had several patients get helped with this in this respect, in which I'm talking about the ability to conceive. And that ability, again, thinking of it in a holistic sense, is impacted by so many things. First of all, the husband and wife can be allergic to each other. That's one big thing that we find with NAT. And if they're allergic to each other, the word allergic is very vague, as I was saying earlier, but what essentially I'm talking about is their energies are just incompatible for whatever reason. Maybe they're having fights, or maybe they're not happy with each other, or maybe, when they obviously are trying to conceive, just something's not working right or whatever. We don't know all the details of the science behind it, but when we treat people with NAT, actually, husband for wife and wife for husband, in that situation, we do see a benefit. Patients often claim that they feel better when, even when they're just sleeping next to the spouse. They get like less heart palpitations, less headaches, less joint aches, things like that. So on a physical level, but also on a mental level, there's a lot of emotional work involved in this too, where we can treat people for, all these negative emotions and things of this, and for people. And if we treat them for those things, we do find that people also feel better. As I was telling you just a while ago, depression now is being shown to be related to inflammation in the body and things of this. So I think that's where NAT really helps you, because when you're eating certain foods, maybe the inflammation is getting worse, and then that leads to you not being, nice to your husband or wife, and et cetera. One thing leads to the next, and then it just becomes more difficult to conceive with all of those extra factors there. It's by no means a guarantee that by doing NAT that a husband and wife will be able to conceive. We've had, some patients have difficulty with it, but at the same time, we've had a lot of patients do well because of some of these other things that come into play. Especially I think this would be really important in the situation where the doctors don't find anything wrong necessarily with the husband or wife, and they just can't explain why there's, a problem. This is where NAT, I think, really comes into play, because it could be an emotional situation or something like that that's involved. I treated my wife before she was pregnant for many things, including myself. I treated myself, obviously, through my mom for many things before we had our son. Our son's now almost 4 years old. But I can tell you, by treating all those things, it just made things so much easier. Her pregnancy and delivery both were just so kind of natural is the word I want to say, in this day of C-sections and medications and all these kinds of things that are going on around us. We didn't have any of that. It was so kind of refreshing. It's such a refreshing experience, actually. And I think I attributed that to NAT.
That's so cool.
Yeah.
And the other thing, too, is by both you and your wife getting NAT prior to conception, any type of potential genetic allergies might not get passed along, right, to your child?
Yeah, that's a really good point too. So after conception, beyond that for the child, what we've noticed, and this we've noticed in several cases, again, no solid research, but in a lot of our families that come to us, what we've noticed is the first child usually will have like eczema or asthma or be really sick, maybe with autism or whatever. And when the parents come to us, obviously, in despair, and we'll treat the whole family, mother, father, maybe, and even obviously the child. And eventually, a lot of these parents will have another child, and 9 times out of 10, it seems the second or third child will be healthy, and won't need as much treatment. And they'll just bring the child in for just maybe maintenance work or whatever. But it's very rare that after doing NAET on the parents that they have subsequent unhealthy children. Now again, we haven't done any control research on this, but it just seems that way, and so far it's worked out. So, maybe in the future we'll do some research on it.
Yeah, I think that's fascinating because I take care of a lot of families in my office, and I had one family in particular that I was able to do that preconception work with the mom and dad because their first child was sickly with lots of allergies. And sure enough, that second child does not have nearly the health issues that the older child had. So I think that just really points to how powerful it is, and it's ideal, if you're planning to get pregnant, that this is the time now to go in and get that work done. And it's ideally done by both partners, right? It's not just for mom, but mom and dad.
Exactly.
Getting that work.
Yeah, that was my next point. Yeah, that was my next point to emphasize, because we unfortunately do see a lot of men, for whatever reason, husbands, fathers, being kind of not really into so much alternative medicine. Maybe it's a California thing, I don't know, but usually it's the wives or the mothers who come in. Yeah, and and if you only treat the mother or the wife, that's not enough. Obviously, you need to treat the other side to really get the effect you need. So, and hopefully once like blogs like this and words get out about all this techniques, hopefully more people will know, and this will happen, and then maybe we'll see a pattern of this, happening, and more patients will talk about it, and it'll be more popular.
Yeah, I mean, that would be, my dream is that more families that are, consciously conceiving are really, both partners are doing the work to really optimize their own health prior to conception, because it's no doubt going to lead to a much healthier pregnancy, a much easier labor and delivery, and a much healthier baby. I mean, it just makes sense.
Absolutely.
That, and, the other thing I think that's cool is beyond helping to pass along less, like, genetic type allergies through this work, with NAET, it's helping the body detox. So certainly it makes sense that you would want to do a detox prior to getting pregnant as well, both partners. And so I think there's like a dual benefit with going through NAET prior to conception.
Yeah, the other part too that is really important is for a pregnant woman. I mean, pregnancy can be very difficult, especially in the later stages. And a lot of patients get bipolar disorder and depression and anxiety, and not more than that, they also have physical issues like gas and bloating and hyperemesis gravidarum and all these vomiting or during pregnancy and things like this. And we find that when we treat with NAET before pregnancy actually happens, a lot of those issues are diminished, and pregnancy becomes easier to handle, which obviously then leads to an easier delivery. And then once the baby is out, there's less issues when you're taking care of a small infant, which can be, difficult also. So just when you start from the beginning, it just makes the whole journey easier.
It really does. It's one part of optimizing your health, on many levels. I mean, it's addressing physical symptoms, but also mental, emotional symptoms as well can be connected. And so that's what's cool. It's, in my mind, it should be definitely one of the tools that a family that is, preparing for pregnancy is bringing into their routine to really take their health to the level that they want to be. And that's really the audience that's listening to this podcast. These are people that are really consciously making decisions. Like it's educated consumerism. Like what is really in the best interest of my health and for my family. And NAET is certainly one of those techniques. And, it's great for, acute symptoms. Someone comes in with hives, for example, or, it can work in those cases. But if we want to be more preventive and wellness-minded, it's doing that work before there's symptoms.
Right. Yeah, and the non-invasiveness of the technique makes it kind of a no-brainer in my mind for a family who's especially concerned about health issues and things of this. We don't give any supplements usually. We don't, inject you with anything or do any surgeries or give you any medications. The only thing is it does take some time. So that's what the audience needs to realize. And of course, you have to go see someone. We're not at the point in terms of research where we can just teach the general public how to do this stuff. Hopefully someday we would be able to do that, but at this point you really need to go to a professional near you. But I would really recommend it, especially for patients who are desperate. But really, as you said, the best way NAT is used without a doubt is preventative, not when you have the problem. We've seen that with cancer too. When you're in late stages of cancer, it's very difficult. Not much we can do. But patients who are early stage or maybe trying to prevent cancer, we do NAT, and a lot of times, those patients do well. We've now had about 25 to 30 years of experience with patients, and most of those initial patients that my mom has treated, they're all still done well. Of course, no controlled studies here that I'm talking about, but we never know, and it's just worth a shot to do it. It's just about 10 to 15 initial treatments that you would do to cover the basics. So it's not that much, and I would really recommend it for everyone, including husband and wife and the children.
Yeah, for sure. There is that time commitment that you have to see, a practitioner for, like you said, at least 10 to 15 visits to treat the basics, and then perhaps 10 or 15 beyond that, depending on what's going on. But at the end of the day, it's such a great investment in your health, and it's certainly worth the time and expense to be proactive that way. And it's not covered by insurance, but this is really, a financial investment in your overall health. And insurance is a different model of healthcare. They're not preventive minded, so they're really thinking outside the box. But the practitioners that do NAET can accept flex spending or health savings accounts. So there is ways to utilize an HSA or an FSA account to cover these types of services.
Yeah, and that's our number one goal right now. That's my personal job, actually, is to try to do as much research as possible to get insurance companies to start accepting this. We just started a large 1,200 patient autism study last month, actually, globally. We're still recruiting patients for that and getting that process going, but there's controls and placebos involved, and it's a really big study. And hopefully that'll be published in maybe a year or so, hopefully. And then we're going to start approaching, the NIH and bigger organizations. And I do think that, as I said, in 5 to 10 years, the outlook is going to be very different, and a lot of people are going to be able to afford NAT, I think, more, I'm hoping, because it makes so much sense. I mean, I was just joking with my mom the other day. I think NAT can end the Mideast conflict, and, it can do so many things for peace and world, kind of health, global health, I guess is the idea, and it's great, so yeah.
It really is great, and it's like one of those things that were so logical, and it's like, oh, why isn't this more accessible and more available? But I love your passion to really take your mother's vision and take it to the next level. Really, is what you're actively working on, and I just think that's so amazing.
Yeah, well, if the results were not there, I wouldn't have been passionate, definitely, and I would have moved on to the next thing. And but I saw with my own eyes, the patients and how well they did. And now I've been practicing in my own clinic. Oh, I took over my mom's clinic actually, and have been working there for pretty much 10 years now. Initially, I was working part time, but now I'm there full time. And I've treated so many people now. And yes, there are occasional failures, definitely. But we have had tremendous results with so many patients who have already gone to, Mayo Clinic and all over the world trying to find answers, and nothing has helped. And and being able to help them is really satisfying. Once I got that sense of that satisfaction, I realized that this is something that I really wanted to invest in. So that's why I'm in law school now, to help with that whole process, with the nonprofit and, our whole fight with the insurance companies and all of this kind of stuff. And, our research efforts and everything. And I think eventually it'll happen.
Yeah, I mean, I really am excited to see, what the future holds for this, NAET.
Yeah. Mm-hmm.
So let's talk a little bit more. We talked about the preconception work. What about if a woman was not able to get NAET before the pregnancy? She's currently pregnant now, having lots of common pregnancy symptoms. Can NAET benefit her?
Yes, absolutely. In fact, that's a good number of our patients that we see in this group that we're talking about. Obviously, patients don't come to these kinds of things until they have a problem, unfortunately. That's just the way it goes. And it's understandable. But, hyperemesis gravidarum or, early nausea, vomiting during pregnancy, early stages, that's kind of the most common symptom that we see in our clinic anyway. And often when we do the treatments, the NAET treatments, even with just the first few treatments, to be honest, they often feel a lot better.
Okay.
Yeah, so there's, it depends on the patient. Right. It varies on the patient and what they're going through. Some patients might require more, some patients require less, but generally we do see a benefit with NAET for that.
Mhm. That's really, really cool. I mean, and even if you think about a woman who's having a lot of edema, swelling in her joints, ankles and hands, I mean, these are all symptoms of inflammation, and we know that NAET drastically helps to reduce inflammation in the body, which is why it's wonderful for really a lot of different diseases that are inflammatory, including autoimmune. Yeah,
and especially, if blood pressure starts going up and you have a lot of issues going on, this is definitely one thing to add to the list. By no means would I recommend anyone to solely focus on NAET. I think in that situation, you want to be very careful, talk to your physician. But at the same time, NAET is so wonderful and non-invasive that you can easily add it to the rest of the system. As I said, we don't give any supplements or do any invasive procedures, so it's really easy to do. And especially there's food triggers. As I said, food or emotional or, animal triggers that are causing the blood pressure to go up or edema, swelling, et cetera, then obviously, we can do that. We can treat for that, and that should help. So that's the beauty of NAET.
Yeah, it is. And it's like you said, it's really part of the, ideally during pregnancy, a woman has a team. And she has her birth provider, but that doesn't have to be the only practitioner that she sees. I mean, she can have an NAET practitioner. Ideally, she's under chiropractic care, acupuncture, and she's receiving those modalities as a teamwork to help support through a healthy pregnancy.
Yeah, definitely. And
I was just going to say, I've seen some women postnatal that have had some crazy autoimmune type reactions after giving birth. Yeah. And we know that autoimmune issues are really like an allergy to the body. So can you speak a little bit to how NAET can help that?
Yeah, and actually that's the biggest area from our clinic that we see with patients, regardless of pregnancy or conception, even just general adult patients that we see in our clinic in Southern California are the patients with lupus, rheumatoid arthritis, thyroid disease, autoimmune. Those are the really common cases that come to us because unfortunately they just don't find relief with Western medicine oftentimes. And so they end up coming to us. And I can tell you, I've done several presentations on lupus. I have at least 4 or 5 patients where I've had lab work completely go to normal after NAET, which is fantastic. I've actually given presentations on that. There's CRP, C-reactive protein, and SED rate. These are all different terms that we use to measure inflammation in the body in general medicine, and we've seen those numbers drop after NAET without doing anything else. I didn't throw any other medications on them or anything. And, as my mom's example, I just talked to you about with the rheumatoid arthritis and the arthritic symptoms, they often get better with NAET, especially if there's a trigger like tomatoes and nightshades are big triggers, as well as chemicals, detergents, all these kinds of things can be causative factors in causing this energy to be disrupted, like we talked about. And if you can find those triggers and treat them, then you won't have to take medicine that much. And this also goes for patients who have just given birth, obviously, which makes the whole process of caring for a child easier too. So definitely worth the while, to try it out. I cannot guarantee for everyone listening out there that this would definitely help them, but if your practitioner is able to find a trigger and able to do a good job with you, NAT has to be done correctly. Unfortunately, that is one thing that to look out for. But if you do it correctly and you find the right triggers and treat them, I'm pretty sure that the success rate would be pretty high.
Right, and that's such a good point. Having the technique done properly by a trained practitioner listed on the NAET website, and then also finding the specific, because you want to get through the basics, which are things like the different vitamins and minerals and some like common foods that we ingest often. But after that, there could be still a very specific trigger that's outside of the basics that could be a little tricky to find sometimes, and an experienced, trained, NAT practitioner can go there and treat that specific trigger and really see a very big response to that. I wanted to share a really cool story regarding autoimmune about my aunt. So she lives in New Hampshire, so she's not local to me in New Jersey. But after I got trained in NAET, I spoke to her about it because she suffered with psoriasis her entire life, and then it became psoriatic arthritis. So she was really having a lot of health issues related to that. And she found there was one practitioner in New Hampshire, and she would drive 1 hour each way to go see this acupuncturist who was trained in NAET. Sasha, I don't know if you know Sasha. And anyways, so she started doing her training and started treating my aunt, and she was going there weekly, and it just absolutely changed her life. Her skin cleared up, her arthritis completely went away. She lost like 20, 30 pounds. I mean, it was just amazing.
That's great.
She looks like 20, 30 years younger. Like, I was just so amazed to see that. And it's like really meant a lot to me because like this is, a family member that I care so much about. And so these are just, one example that, and it doesn't even matter what the diagnosis is, really. The bigger thing here is finding what is your body reacting to. Like for an autoimmune issue, it could be foods, like nightshades was definitely a big trigger for my aunt, but also an NAET practitioner can treat fluids like urine, blood, saliva, hormones, organs. So even parts of our body can become an allergen, and they can be safely and easily treated with NAET.
Yeah, absolutely. We've even had patients allergic to the cold. So when they hold an ice, ice pack, or if they're in the humidity in Hawaii or something, they'll start getting asthma. I mean, there's all these environmental triggers too. That's one thing I didn't really talk about with NAT that we can treat also, pollen and obviously the typical triggers. But we even have patients who are allergic to a cell phone with radiation, and we can kind of treat that and desensitize them for the cell phone from the radiation. And that's a really good, example to explain the concept of NAT. When, how else do you explain holding a cell phone to your body and it causing a tumor or something? I mean, it has to be through this energy concept or electromagnetic field or radiation concept, And so, that's kind of what we're starting to get at with NAT. So. Yeah, great.
I mean, it can be used so many different ways. I also wanted you, if you could just share a little bit about, like, why maybe an infant or a toddler could benefit with NAET. I know I've seen it in my office using breast milk, for example, as an allergen for babies that are having a lot of reflux.
Right.
How else have you seen it used?
So typically with infants, we, as you said, it's real true medical allergies that they come to us for, like eczema, asthma, vomiting from food allergies, etc. And obviously we can treat those things. We actually now do a lot of blood testing for that to see how allergic they are to different things, and then we can treat with NAT, and then we follow those blood tests to see how far they drop. And actually we've done a lot of studies on this now. We've published a couple of studies on that concept itself, research proven studies showing that we have there's definitely an effect of NAT in helping eczema and autism and allergies, and a lot of these types of things that affect children and infants. Most of our studies, actually, to be honest, are in the group of children. So we had the first study that was ever published on NAET was a case report from Amsterdam, actually, I believe in the early 2000s, on food-related eczema. I believe it was milk. And then from there, we've had several studies. There was a large autism study that was published, a 60 children study that was broken into two groups, control and experimental. And that was published with really good success in autism, ages 2 to 10. And then we've had a couple of other, a smaller study on peanut anaphylaxis in children, showing improvement, and as well as a case report that I personally published last year on peanut anaphylaxis. And in that case report, the blood test actually dropped significantly after the NAET. So all of these allergies, the IgE level, and there's a different test that we use to show that the person has a blood allergy to the item, the food item. In this case, we just chose peanut. But it can apply to milk. It can apply to eggs. I mean, it can apply to anything, breast milk as well. So, children and infants, toddlers, even adults who are allergic to these things, we can treat with NAET, and we have now evidence to show that it does work. There's no doubt about it. Of course, that's not enough. We need larger studies and more controls and all that. That's why we're doing more research. But we do have at least a solid foundation to work with on that, especially in that realm. Eosinophilic esophagitis also is another very common diagnosis being made these days, and a lot of the infants and toddlers out there, especially in this group, might find that doctors throwing that word out at them. That also is very typically related to allergies, food allergies. FPIES, F-I-I-E-S, is another common thing that we hear out there now. It's food protein intolerance syndrome. Basically, that's a similar type of situation where we treat people. So all these things, if once the conception has happened and the baby's delivered, and now we're dealing with a child with these food allergies, NAET is really effective for that group.
So effective. And, in my practice, I find that, babies and children just clear so much more easily different types of allergens than adults. They have less, blocks, so to speak, in their energy field and their meridian. So they respond so quickly. It's totally non-invasive. Even a common diagnosis that I see in my office is silent reflux, and that just makes me want to bang my head against the wall.
Yes.
You put these infants on Prevacid or other proton pump inhibitors, and it's really damaging to the gastrointestinal function of that baby. And instead, something like NAET can be really effective, and then that child isn't going to have that reflux or that vomiting, and they can actually properly digest their food.
Yeah, we had a 3-year-old actually from New Jersey come to us all the way here to California just to see us for this specific issue of reflux. And what we found was he was on Prevacid and Protonics and different other medications to help with it, and it was keeping him under control. But, it's not good to be on those medications for long, especially in children, because they can inhibit growth and they can cause slight tumors in your stomach in rare cases and things like this. So I told the family, look, let's try NAET and get him off of this as best we can. So we did NAET initially, but we kept him on the medication just for his safety. But we treated him, and after about 20 treatments, he was fine. He felt great, and we took him off the medication eventually, and now a year later, he said he's feeling great. His mom said he has no problems, and he has not been on the medication ever since he came to us. So that's the kind of the model of NAET is, trying to help the patient. I mean, medications are okay and they have their place, absolutely, but it doesn't mean that you have to use them. I mean, if you can find a way where you can be natural and be healthy, then why not?
Yeah, you want to do the non-invasive treatment first, and then if that's not helpful, then you would move on to like a medication, as a later avenue. I know we have to wrap up this call, but is there any last really cool studies or cases that you've had in your office. I mean, you mentioned autism. You want to share with and people might be like, what does autism have to do with allergies? Can you speak to that a little bit and how that's, you're really changing these children and families' lives?
Yeah, sure. That's also kind of an interesting story from my mom's perspective. We never really knew for sure that they were connected to allergies, autistic patients, that is. But what happened was early on, my mom was treating these patients because no one else had any treatment for them. I mean, autism is as of now an untreatable condition, essentially. And so these parents, obviously, they're very distraught, and they wanted to do whatever they can. They heard about my mom through the grapevine, so they would come over and get treated earlier in her career, and she found great success with them. That's when she started thinking, okay, let's try this more and see what happens. And eventually, it led us to this large study that we published in a couple of years ago. It was actually done in 2004, but it took us a while to get it published. But once we did that study in 2005, we realized that this is tremendous, opportunity for NAET to treat patients with autism. And eventually, after we started doing more blood tests and things, we realized a lot of these patients with autism have positive results on their blood tests. If you test an average patient with autism for these IgE markers and blood markers for the allergies and things like this, you'll notice that there's a correlation between traditional allergies and autism. So a lot of these autistic patients will have sinus infections and, hay fever type symptoms, eczema, rash, and all these. You'll notice a lot of these symptoms happening in these patients. And what I guess, thinking back on it, again, there's no proof of this, but my personal philosophy on it or thought about it is that the allergies kind of early on in adulthood or in childhood cause this inflammation cascade to increase. And maybe that may have led to some injury to the brain or somehow causing the child harm and leading to autism. We haven't really done any studies to prove any of this, but maybe the vaccines as well is contributing. I don't know. Maybe by being allergic to things that all these different medications or vaccinations or whatever could be contributing. That's obviously a very controversial topic. But whatever the case may be, when we treat with NAT, we do see improvement in these children. Now, once they cross about 10 or 11 years of age, though, it's quite difficult for us. The results are not as dramatic, and it takes a longer time. So as you were saying earlier, the earlier the better. So if you have a 3-year-old who is just diagnosed with autism, take them to an NAT practitioner by all means. I would encourage everyone listening out there, if you have a child who is just diagnosed with autism, take them to an NAT practitioner and get treated and see what happens. It's definitely worth a shot. Yeah,
that's so true. Wow. Thank you so much for coming on today and sharing all this really wonderful information. Can you share with our audience your website for your clinic in Buena Park, California, and about the research that's on there?
Yeah, sure. So our clinic website is oc-integrative-medicine.com, oc-integrative-medicine.com. And if you go on the website, you'll see several tabs there, and one of the tabs says research on it. If you click on that button, I have kind of conveniently put all of the studies that I think are important for NAT there on that page. There's nothing else on that page, so you should be able to just click on the link and get the article. And I think the research is really important, for patients to understand this more. There's a lot of discussion that goes on in the articles, too, talking about NAT. But obviously, it all starts from my mom, without a doubt. And she has an excellent book called Say Goodbye to Illness, which I would highly recommend. It's from the source. I mean, it's how my mom thought, about everything as she was going through it. She writes as she thinks, essentially. And I guess that's the best way to kind of get a glimpse as to how this came about. So that book is excellent. The articles are obviously you can download anytime. That's pretty much it.
Yeah, and then you can also, to find a practitioner, just go to NAET.com, and then there's a a link to put in your zip code, right, to find local to you.
So yeah, www.naet.com, and then if you click on patients, there will be, if you scroll down on the lower left-hand side, you'll see a Find a Practitioner link. You click on that, and then you can type in either the zip code or the last name. Probably best do zip code, and then you can search anyone near you.
Yeah. Awesome. Well, Roy, thanks again for coming on the show today. I really appreciate it.
Oh, it was really great. Thank you so much for doing this.